really for more than a decade now, there's been a noticeable increase in cancer diagnosis rates, and unfortunately, especially among young folks. In the United States, we've seen nearly a 13% increase in just the last 20 years. It's not just happening in the US, we've actually seen that happening globally, significant increases across North America, in Australia and Western Europe. And this surge in early onset cancers has, I think, really sparked concern not only among medical professionals, but again, among policymakers like me who make funding decisions related to cancer research and prevention, because it really threatens to stop or reverse some of the progress that we've made in cancer treatment and prevention over the last few years.
I know this is a significant change in the last decade of individuals younger getting cancer. Just for an example, colon cancer now used to be 1 in 10 for individuals under age 50, and now it's 2 in 10 or 1 in 5. There are other increases: leukemia, some thyroid cancer, some even pancreatic issues. So there's a definite trend. Usually, everybody thinks cancer is somebody who's older. For younger folks to get cancer, rather.
When we talk to the medical professionals and within the House Cancer Caucus, a lot of what we do is just trying to listen to people who work in this space. Some of the factors that are believed to be contributing to the trends are things like decreased, physical activity. We're all eating more ultra-processed foods. Exposure to some environmental toxins is a factor in this as well. We're seeing, particularly among young people, a substantial rise in gastrointestinal cancers, and that shift is prompting a real reevaluation of lifestyle and environmental influences. But these trends are concerning, and I think it highlights the need for more research, both to understand what's going on and then to combat these rising rates.
There are a lot of postulations and there's a lot of thought, but I think really the highest interest can be in childhood obesity. Now, I think the statistic is 40% of kids in 8th grade are considered obese. We have so many individuals that can't make it into the military because they're not physically fit. Number one, and I think this is really the biggest, probably the one with the most reasoning behind it, is that biggest culprit rather is our diet, is our processed foods. We eat such a highly processed food diet. Now, it's interesting to compare cancer rates between here, Europe, Japan, for example, but this has to be something that's going on tremendously in the American diet.
We need to increase rates of cancer screening and diagnostics, full stop. That we know that early detection, we know that early diagnosis saves lives. And just to give one example, though, only about 4.5% of people who are at high risk for lung cancer were screened for lung cancer. So that's a problem. But the other piece of your question is, how do we reduce some of those barriers like cost and insurance coverage so that more people can get screened? And listen, a substantial amount of progress was made through the Affordable Care Act, which actually requires insurers to cover some of these preventive services and screenings when they are recommended by a task force called the U.S. Preventive Services Task Force. When that task force says this is something, this is a cancer that at this age someone should be screened for, or based on these risk factors, then under the Affordable Care Act, insurers are required to cover those preventive services at no cost to their beneficiaries. That is a big deal.
I think it should, number one. Let's just put it out that way. If colon cancer screening was usually started at 50, I think now they've moved it back to 45. Same thing with breast cancer in earlier age. Sadly enough, so many young women now are affected with breast cancer and die early. Breast cancer is oftentimes people make an analog with prostate cancer in men. You can't do that now. Prostate cancer is still a disease generally of over 50 individuals. When you have creeping parts where it's younger for women, these mammograms are just critical. So yes, insurance companies should be required to do that. They have, they have the money to do that without raising rates, and they should be required to do that.
So in the last Congress, there was a bill that was signed into law that was focused specifically on new funding for pediatric and young adult cancer research at the National Cancer Institute. That also included setting up at the national and at the state level registries that can help track and study adolescent and young adult cancer cases. So that can be really helpful to researchers as they evaluate and identify the most effective therapies and treatments.
I think we were doing a great job of that pre-pandemic. I can just think from my own experience what has happened in the field of oncology and cancer even in the last decade, with adults and with children. Used to be so many childhood leukemias were death sentences. Now they're not. Yes, sadly enough, children do die of cancer, leukemia, kidney tumors, and these type of things. We were making great strides in research. I do know that when COVID came around, poof, a lot of the labs in pediatric oncology disappeared. Everything got put into COVID. And whether that's creeping back up to pre-pandemic levels, I think it's going to take a decade for that to happen.
2 years ago, President Biden reignited the Cancer Moonshot program. That laid out an important and somewhat audacious goal of reducing the death rates from cancer by at least 50% over the next 25 years. We cannot make that goal without improving cancer prevention programs for young people. We can't. So there has to be investments in research and innovation focused specifically on cancers in younger adults, and just trying to get a better understanding why we're seeing this increase. It also means making sure younger adults have access to high quality, affordable health care. These questions around the Affordable Care Act, making sure that we see young people having coverage for cancer screenings, for diagnostics, for treatment. All of that's going to be really important if we're going to tackle reducing these death rates aligned with the Cancer Moonshot.
The quote Inflation Reduction Act came in, and I do not agree with attacking some small molecules and everything else, to certain types of medications, biologics, not allowing new discoveries to be made. We know that close to 200 cancer lines, studies that were drugs that were going to be used either in cancer and rheumatological disorders, were taken offline because of what's happened because of the IRA. I've submitted a bill called the EPIC Act, which seeks to restore some sanity to this and give some balance to letting pharmaceutical companies do what they do best, and that's innovate.
Cancer touches nearly every person in this country. And so making sure that adequate funding is provided for cancer research, for prevention, protecting access to cancer care. Anytime you hear discussions in our nation's capital about repealing the Affordable Care Act, remember, the Affordable Care Act has protections for things like requiring that preventive care be covered without copay, and making sure that young people can stay on their parents' insurance until their 26th birthday. Those sorts of things really matter if you want to get a handle on cancer among young people. Working toward meeting the Cancer Moonshot's audacious goal of cutting cancer deaths by 50% over the next 25 years. All of these things, the House Cancer Caucus is pushing on. It's something that I'm pushing on, and I'm really hopeful that we'll hit the benchmarks on the way to finding cures.
And a good portion of what I do as a urologist is cancer therapy. And I look at the different ones. Kidney cancer, for example, if I, operated on somebody with kidney cancer and it spread outside the kidney at that time, it was not much a decade ago. And the same thing, we had better treatments for something called a Wilms tumor, which is a cancer in the kidney in young individuals. They had a lot of good treatments before, but now it's been a light year jumping exponentially into greater cancer cures and greater expectation of being cured from the cancer.